Hi everyone, welcome to my channel. Today we'll be learning surgical instruments, and first we'll start off with patient safety, which would be by pulling this cap up. Even though I believe that my pixie cut is super cute and I want everyone to see it, I don't think the patient wants to see hair that could potentially drop into their surgical site. So we're just going to start with covering all of that up. Now we're properly wearing the cap. So next we're going to go get started on these surgical instruments. So here you will be able to see all of the surgical instruments that I will be showing you guys today. These are just the things that I kind of want to touch base and go over. Honestly, this is my first time ever reviewing them. So we're going to have a good time. Okay, really quickly, I do just kind of want to show you the items that we'll be looking at as a whole, as you can see right here in this area. And I do have on a pair of gloves, even though this is a mock look at the instruments. I do kind of just want to make this as realistic as possible. I have the tweezers, or what I believe to be tweezers here. I have surgical scissors lined here, what I believe to be retractors. I think this would be some sort of saw. More what I think are forceps, retractors again. This is a scalpel's knife handle. And from the looks of these hoses at the tip on the nozzle, I believe those are suction tubes. So let's go ahead and get into them. So again, just kind of looking at these different types of tweezers. They range in size and thickness. This one particularly is huge. Like, this is enormous. As you can see, my index finger, normal size hand, has, this one is just enormous. Like, this is just huge. So I'm gonna pick this up here and I just kind of want to take a look at it. This is just gigantic. Like, I believe this would be used for like grasping, and they have like little teeth, kind of. I don't know if you can catch, the camera can catch that, but I believe that might be grasping like some form of a tendon, maybe. I don't know how thick and heavy duty they are. I also believe this one, you see the teeth there, I believe this one also may be used for, I think this one also might be kind of used for gripping a tendon or something. As you see that they have teeth. So grips here just to make it easier to maybe get a good grip on it or hold. Kind of want to move on to the scissors now. These right here, these look to be curved. They seem pretty sturdy, so maybe cutting through a muscle or, again, tendon. My first thing to think of is maybe cutting through a tendon there. I believe these right here are used to maybe hold on to something. As you see the rib teeth there, they're curved. I believe this one would be used to maybe hold the needle for a suture. Maybe both of them are technically. Hold the needle for a suture. They have these locks there to keep them from opening. So you can see. There we go. I think this is a retractor. Has a handle there. And you have a hook to kind of stick it down in there. Maybe a muscle, maybe some tough tissue. I'm assuming this could be even used on like the abdomen or like the leg or something like that. This one is huge. This is a big guy. So this has to be used on some really big tissue. Like, I have no idea where to even think that this could be used at. But I don't know if we're using this end or this end, or maybe both. I don't know, but it's gonna be fun to learn about this one. These scissors right here, or I'm assuming we're gonna be grabbing some items with this, maybe holding like a cloth or some form of, I think this one would be for a cloth, holding some form of a towel to kind of maybe get some of that fluid and maybe saline even out of there. These look like small retractors. So this looks like a small retractor, maybe used for delicate tissue, maybe just something that doesn't require, you know, one of these big guys. So again, I believe that these would be utilized for suctioning, just real quick, you know, kind of reducing the amount of moisture and fluid in that region. This scalpel handle, I believe this would be used for a rather longer scalpel knife, scalpel blade. You see there's some etching on there. Here, some ribbing for grip. Sorry if my camera keeps on focusing. And these are what I also believe to be retractors as well. So they separate, but I'm going to keep them together just for the purpose of the video. I don't think we need to separate those technically right now. However, this does kind of go over everything that I have here in front of me, including this big guy. Some sort of maybe blunt saw. Maybe it's blunted for the educational purposes. So yeah, thank you so much for watching. Part 2 to the video for the instrument basics. Earlier we went over how the instruments look and the way that they could possibly be used. This right here is just OR survival instrument basics. I'm going to choose 4 cards to review medical devices that we possibly would be using in the OR and talk about what we just might use those for and what they could just possibly be called. So let's go ahead and I'm just going to take the last 4 cards. Is this 4? Yep. So I believe that these are tweezers of some sort. Just judging by the end of it, looks like they have some sort of lip or clamp to it. So I'm assuming these will be used for, of course, pinching, pulling things out, or holding something together. And looks like the answer for it is Addison pick with teeth, hence that little lip and grip that we can see right there. And it says that this is typically used when closing the skin with sutures or with staples, so we're kind of spot on. This right here appears to be a stapler and could just be that Addison pick with teeth being used in this very moment. So that's pretty cool. But it says what's happening in this picture. It looks like we're suturing. Like I said, that Addison pick looks like that's what's being used. In addition to that, it looks like a staple gun. So actually looks like we're spot on. This right here appears to be some sort of aspirator or suction tube or hose. Even could be quite possibly used for maybe rinsing or saline. I don't know the name of it, but looks like we're gonna figure it out. It's a suction line. Looks like it connects to the wall suction, and sterile suction tip of choice. So it looks like we're pretty spot on. These appear to be rags or towels, and I'm assuming we are using these to clean something up. So surgical towels, and looks like they're multi-purposed, used to create a barrier and establishing a sterile field when draping. So we have a ton of other cards here that we could use to learn from. However, we are just choosing 4 today. So we'll go over more in the future, and thanks for watching. Bye for now.